A very good morning to Madam Radina and my fellow friends. Today, my group and I will be presenting our Principles of Economics group assignment, which is on influenza and how it has affected our country's economic growth. I hope you all enjoy. So, to start off with our presentation, let's first introduce our group members.
Hi guys, my name is Praveen.
Hi, my name is Munawir.
Hi guys, my name is Fatin.
Hi, madam. My name is Farah.
Hi madam, my name is Shazwani.
Hi, my name is Soli.
Hi, my name is Harry.
Now, let's have an overview on the contents of our presentation. So, first off, we'll start with our introduction, followed by our impacts, solution, effectiveness, and finally conclusion.
So guys, let's start with the introduction. An influenza can be defined as a virus that spreads over a huge, either multiple continents or worldwide, and also infects a large proportion of the population. Moreover, pandemic influenza is an acute viral disease of the respiratory tract. Apart from that, it occurs when an influenza virus that was not previously circulating among people and to which most people have immunity emerges and transmit among people. Besides that, influenza virus also targets personnel preparing to respond to pandemic influenza outbreak, including medical professionals, public health officials, incident managers, and risk communication experts. Influenza virus can infect people easily and spread from person to another person in an efficient and sustained way.
Though the influenza virus is usually compared to the common cold, which is usually a non-deadly form of sickness that only causes mild forms of illnesses such as diarrhea and vomiting, it, on the contrary, is a deadly virus which would cause side effects ranging from severe illness to even death. In the past century alone, this fatal disease has caused many pandemics all over the globe, across multiple different eras throughout humanity's span of longevity. For instance, the pandemics in 1918, 1957, and 1968 have broken out in different parts of the world and have caused a magnanimous loss of life, which at the time were irreparable losses that shook our species to its very core. To further elaborate on my examples of pandemics which have caused a severe loss of life throughout humanity's reign on the globe, the Spanish flu of 1918 killed approximately half a million people in the United States alone. Aside from that, in addition to the wide range of pandemics that have been provided, another instance of terrible breakout can be seen in the United States in 1957, where the infamous Asian flu, which originated from China, killed as many as 70,000 people, whilst the 1968 Hong Kong flu killed nearly as many as 34,000 people. Due to the combinations of people's ignorance as well as the malinformed nature on these topics, many still view this disease as a non-threatening common illness, which is quite a worrisome matter, as the 20,000 deaths per year and 100,000 hospitalizations worldwide are widely overlooked.
Impact to the Malaysian economy. Influenza is known as acute, highly contagious viral infection that causes annual epidemics. To more elaborate about this issue, the spectrum of disease ranges from mild to moderate in the majority of the population with severe illness and death occurring in high-risk population. Moreover, influenza virus can disease to the young age people and also older people as well but highly risk for this age group of 65 years old and above. Secondly, family is one of the reasons for this infection because each member interacts with different groups of people such as family gathering, party, and the returns to the family, increasing the risk of infection spread. Each and every individual are the least likely to become infected. This issue affected the economy by giving impact on society results primarily from lost work time and reduced productivity for patients and caregivers, and the usage of medical resources increased such as healthcare professionals' time prescribed medications, laboratory investigations, hospitalizations required to treat patients. The gross attack rate expresses the percentage of the population that is likely to become clinically ill. The potential rate is quite high. Typically, influenza pandemics have a gross attack rate of 20 to 40%, affect consumers' confidence and change consumption and social patterns.
There are three effectiveness of the supply side, which is markets tend to overact, affect the availability of labor as illness will force many workers to stay at home. Government will have to deal with an uncertain policy treatment.
For the Malaysian savings and investment, Malaysia play a role as an essential part of the global economy and is a major exporter and importer of goods and services. Malaysia also provides a significant percentage of total world saving and receives a significant percentage of investment. It also impacts the health of the labor force. And lastly, the impact of the pandemic is more severe. The supply shock will be greater due to the absenteeism of otherwise healthy workers. So, let me introduce a solution by the government. First of all, government has taken up the responsibility in order to bring up the economy in Malaysia. Malaysian government has started to learn and collaborate with the countries which have the experience in solving this problem. Some strong countries such as European countries are not able to spare from this influenza virus. Our government had tried to strengthen international collaboration with the aim of stopping the economy from deteriorating. Government had taken a vital step in stimulating the condition of the economy in the country. The solution conducted by the government was to adopt fiscal policy, for example, decreasing tax and increasing government expenditure. Income tax has been reduced to increase the consumption of consumer of the products and service. In this case, increasing public spending due to an increased amount of monthly salary will lead to a growing tendency of the economy. Government expenditure increase means that government will increase their budget for providing more money in the market through providing subsidies and allowance to low-income families. Moreover, the vaccine is therefore a safe and clever way to produce an immune response in the body. The solution that had been carried out by the government was pharmaceutical intervention, which is vaccine. It benefits the local economy because vaccination will decrease the number of people suffering from influenza. Based on this situation, labor can go to work and it led to increase of productivity when the labor is in good health condition. Employment rate of the hospital also increased as more nurses and doctors are needed to cure the patients. The ministry even sponsored a vaccine just to let all people have the opportunity to be vaccinated.
Now, the infection rate among students can be decreased and the risk beyond them will also decrease if the school tighten the laws. Those who show symptoms while they were at school will need to be quarantined in a special room or a sick bay. It is also similar to those students who are staying in hostel will also need to be quarantined until they recover. One of the government solutions is to control and prevent from entering into the country firstly or occurring during transmission in the country for the aim to reduce and distribute the demand on health service. In order to achieve this targeted planning, entering point screening is mandatory for travels from pandemic country. Datuk Dr. Hadi Ismail say during that period, any tourist that entered the country via Malaysia, Thai, and Langkawi International Airport was required to undergo a temperature screening. Not just that, the community also need to take responsibility for self-help monitoring and reporting if they were ill. It is important, especially to those who are working and work at affected countries. They need to take medicine or contact the health facility for advice for them to not get affected. Not just that. As for private hospital, they need to coordinate all the activities conducted on the hospital to control the affection towards the patient. Not just that, they also need to quickly refer to all suspected influenza patients to the nearest designated hotel so that it will not affect other patients that also have high risk towards the virus. Association that have to teach the society if they felt ill, they need to come early for treatment to prevent effect to others. It is also easy for the primary care of influenza because they prepare all the facilities for the patient.
For the effectiveness of the solution, firstly, there was a substantial amount of retrievable data showing influenza vaccine was successful in lowering influenza virus.
Secondly, the government had adopted non-pharmaceutical intervention such as social distancing and wearing masks in order to protect the local people.
Those who are having influenza symptoms was not allowed to attend school in order to prevent pandemic from spreading among kids. People who have the symptoms should stay at home for the infection period, which is about 7 to 10 days after they are become ill.
Next, control and prevent entering into the country, firstly or occurring during transmission in the country for the aim to reduce and distribute the demand on the health services.
They also use the mathematical models demonstrate that population size, travel rates, and place where travelers reside can strongly influence delay. Mathematical models have found that strict border closure could have helped limit viral transmission in the pandemic in its early days.
And lastly, Malaysian Medical Association has to teach society if they feel ill, they need to come early for treatment to prevent infection, so that you'll know whether you should go to the emergency room or not. Society also can receive personalized medical advice about your symptoms.
So, for the conclusion, influenza virus gave a big impact on Malaysian economic, but overcome it with many solutions by the government. Before that, influenza is known as an infection respiratory infection caused by viruses that infect the nose, the throat, and occasionally the lungs. It can cause mild to severe disease and it can even result in death in some cases, mostly to high groups such as children, elderly, and the pregnant women. And those who have chronic disease. The easiest approach to avoid the flu to get vaccinated, issue and quarantine. Those who are affected during seasonal outbreak and pandemics, influenza vaccination is the most effective technique for preventing infection, reducing the severity of illness and saving life.
Next, Malaysian economy become downward. The labor productivity, demand and supply are affected by the pandemic. As we analysis the findings toward the demand and supply scenarios, work through the demand side as aggregate consumption declines and there is a reduction in the trade of services, including tourism, and through the supply side, as the disease impact the health of the labor force. For the labor productivity, they decrease because employees have to quarantine and have to stay at home to avoid getting affected. Because of this, many people become unemployed.
Lastly, many advanced advanced solutions have been made in the creation of influenza vaccine and antiviral drugs to prevent and treat the influenza virus, and systems are in place to provide early warning of pandemic virus. However, much more must be done to ensure that persons at risk of influenza and its consequences, as well as others who come into contact with them, obtain the vaccine. To improve vaccination protection, KKM and other healthcare providers will need to educate their employees, clients, and peers about the influenza susceptibility and severity of the disease that influenza can cause so that people can take further action because they have been advised and adapt to it. The organization must evaluate the benefits, attitudes, and perception of its customer on a regular basis so that they can decrease the number of people affected. So from what we can see, because of the pandemic, it gave a big impact on all of the communities, not only society, but also the countries of economy. But luckily, government has such kinds of solution that can improve the economy back on track. That is all from us. Thank you.